Welcome to On The Beat, everyone. I'm Troy Thompson. Today I'm joined by Dr. Stephen Yarborough and Tony Faulk from Louisville Dental Associates to fill you in on everything when it comes to crowns. I love the conversation about crowns. Welcome to the show, guys. How are you?
Very good. Good
All
to
right.
meet you.
There's a lot of conversation out there when it comes to veneers and crowns. Now, I believe you don't do veneers, correct, Doctor?
We do them just very sparingly. It's a veneer, if you're wanting to know the difference. It's just partial coverage of the tooth, whereas a crown is full coverage, the front and the back of the tooth.
What's the benefit of doing a veneer versus a crown?
Benefit of the veneers, probably the biggest benefit is not having to prepare every surface of the tooth.
Right.
But with the crown, you do prepare every surface of the tooth for the crown, removing about a millimeter and a half. And but they do stay on better. Yeah, you have problems with veneers coming off a lot.
Okay.
Yes.
Tony,
Occlusion is a big deal with veneers.
And that's what I want to speak to you about, because being the in-house technician, and we want everyone to know as well, Tony is the owner of Louisville Dental Associates. I want to ask you, when you're making a crown, is it a different process to dentures?
Yes, because you use an oven. You can use metal, you can also use all ceramic. I choose metal primarily as my substructure, and then with a nice layered porcelain through a process of firing the porcelain, and then it fires all in one, and then we place it in the mouth.
All right, I want to talk to you about this incredible 3D imaging machine that you use at your practice. Now, this is the latest and greatest when it comes to technology.
Yes.
What is it and why do you use it?
We're truly blessed to have it. It's a machine that enables us to see certain anatomical landmarks that cannot be seen on a conventional X-ray.
Right.
Sure.
What's the purpose of it, though?
The purpose is in planning implant cases. You can see where all the nerves, blood vessels, and everything, musculature runs throughout the mouth, as well as you can even look at the number of canals in teeth if you're doing a root canal on a tooth.
Why is it important that you're using the machine in the practice for you as a technician?
The bone thickness. If you place an implant, it tells you exactly where you can place it, and it also gives you a pretty good degree of certainty of success or failure. It's a nice little warning too that says I can't place something there, or I can place something there. Your success level goes up about 100% by using the machine.
Well, I would also think longevity as well,
correct.
because you're
Correct.
so precise with where you're putting in the crown.
It does not lie.
Okay, I want to ask both of you, and you can both jump in on this, the difference between a crown and bridge work, and why would you need one or the other?
Well, a crown is just a single tooth replacement, generally for a tooth that's damaged or had a root canal done to it. Bridge work is more or less replacing a missing tooth with teeth on either side adjacent to the space and crowning them with a tooth welded, so to speak, in between the two other teeth.
Right.
What's the aftercare when it comes to crown and bridge work?
Basically just like a regular tooth.
Okay.
Brushing, flossing, and seeing your dental and the hygienist on a regular basis.
Well, I assume you're the person that chooses the colour of the tooth to match, right?
Well,
Not me.
You're working right beside Doctor in the chair.
That's up to the patient.
No,
I try and let the patient decide what they want, but we can guide them. I want it to look natural. I don't want it to look fake. I don't like for my patients to get into their teeth to arrive into a room before they do. If you know if you get where I'm going to.
Yeah, I totally agree with you. There's nothing worse.
The smile should just be a part of your face. It should not be all of your face.
And that's why you guys are so busy with this information. Thank you so much.
Thank you.
We really appreciate it. If you want to find out more information, there it all is up on the screen for you. Louisville Dental and Associates, give them a call and let them help you with a bigger and brighter smile.